And greetings. Thank you so much for joining us today. This is Ellen Kamai, the Natural Nurse. And as always, we are wishing you the best. We have so many classes and workshops coming up right now. If you are on our mailing list, you will get our online schedule. And of course, you can just go there yourself at any time by going to naturalnurse.com. And then the best place to visit is calendar, because that's where we have the events listed. Now, in addition to all the calendar events, we meet privately with people every single day. Lots of your friends that are listeners here on The Natural Nurse and Dr. Z, and many others as well across the country and the world. And we talk about different things, such as how can you be a registered herbalist? That would be something that is recognized as a professional herbalist. How can you work towards that? Or how can you move your professional life into something that generates an income from natural health? Because there are many, many paths in that direction. And for that, we have our course called Career Paths in Natural Health. And then we have hundreds of very specific seminars and webinars that are available online or privately. We have one coming up on November 14th called Hemp, Hows, Whys, and Wherefores, and that's an online event, and it is free to any kind of healthcare professional. You can register at Gaia Professional, and that's a very interesting, in-depth scientific presentation. And then we have also that same presentation coming up with, and by the way, that one online has CE credits for NDs and DCs and RDs. So if you are a healthcare professional, you can for free take that class and get CE credits for it. We also have an on-ground presentation coming up in November at the Forest Hills Community Center in West Palm Beach, and that has 2 CE units for massage therapists. So all of this is online to find out the exact address, and that is open and free to the public. Anyone can attend. It's 7 to 9 p.m. on November 21st. Then in December, we have an online one that has CE credits for all kinds of professionals, such as RDs, DCs, nurses, nurse practitioners, midwives. So any of those people can take this. It's called Herbs for the Holy Days. We will focus on the herbs that are used both for spiritual and health reasons that are very common during this season, the fall season. So that's available online. Look at naturalnurse.com calendar. And then we have one on 4 classes in natural remedies. We have one coming up on Hildegard of Bingen, the mystic, psychic, visionary herbalist, and that's going to be at the Broward County Healing Light Network Holistic Nurses Association meeting. So we just have almost every single day classes and workshops for you. If you don't see one of the group offerings, we do every single class also available on an individual level, and many of those have CE units as well, so you can get in touch to check. Today, we are so happy to have as our guest Leslie Alexander. Dr. Alexander is a PhD as well as a registered herbalist, and she's a clinical herbalist with a community practice in Erie, Pennsylvania. Dr. Alexander is a scientist who focused on environmental factors affecting children's health, and she is also the author of Dental Herbalism, Natural Therapies for the Mouth, and we'll be talking to her about that and other issues. Thank you so much for being our guest today, Dr. Alexander.
Thank you for having me, Ellen. It's a pleasure to spend some time this morning with you.
Well, I want to go into your background a little bit. What in your past led you both to be a scientist and then to be someone who focuses on herbs?
Oh, well, those are big questions. I'll do my best. Science, I suppose in the 80s, I was very much an environmentalist and began an undergraduate degree in environmental science and later began looking at stressors of plants for my PhD. That was overseas in Scotland. And I was attracted to the thought processes of science. I was attracted to research and digging deeper and evaluating different sources of information and and supporting health in general. So my work as a research scientist really focused on children's health, and my progression to changing careers seemed nothing but natural to me. I had been a gardener for years, very interested in culinary herbs. And while I was overseas, I grew more and more interested in medicinals. I was also affiliated with the Department of Public Health, and I got to see some of the very positive benefits of allopathic medicine, but also some of the confounding factors many people are aware of, that symptoms persist after courses of treatment are identified, that there are unwanted side effects associated with various pharmaceuticals. And then, of course, coming back to the States, why there's the expense of medicine in general. And while I certainly believe allopathic medicine has a place in our lives, I am also a very strong advocate of the people's medicine. And that, of course, would be herbalism, as you know.
Yes, that's true, because certainly if you talk about traditional use, there's actually no time known in history in terms of any human society that did not use herbal medicine. One of the ones that I am studying more recently is a mummy that was found who's called Ortzi. Very interesting mummy. And he was mummified thousands of years ago, and he actually had a medicine pouch with him filled with herbs.
I remember that being reported. Yeah, I think, we were very much taken up by the pharmaceutical industry and the promise of health and wellness that was offered to many of us. And one of the things that I think would be true to say that since the beginning of time until recently, people have thought themselves to be a part of a health equation. They used foods, they gathered herbs, they used local materials to support health and wellness often. And certainly here in Erie, I see people both doing this more and more and relying less on traditional remedies.
So by traditional remedies, do you mean herbal remedies? Because those are traditional remedies versus pharmaceuticals.
Absolutely. When I use the word traditional, I'm talking about plant medicine. I'm talking about walking out into our backyards, whether it is to care for a bee sting or a sore throat, or even to care for the health of our mouths, and finding local plants, maybe some roots or maybe some leaves or maybe some flowers, knowing which plants to use, what parts to use, and how to prepare them. I'm all about that.
But that's a lot to know right there. And so many people may come on an herb walk, which we do, take an herb walk and see what plants are local. I think that should be knowledge that everybody has, because there are almost always something like dandelion around, something that has no poisonous lookalikes that you can experiment with. And it's such a lost art, but really only recently lost, because if we look back 1 or 2 generations, most grandmothers and grandfathers actually knew a lot of these simple remedies that grew right outside their door.
I completely agree, Ellen, and it is so heartening when I attend conferences and see the children, the young children of herbalists, falling down and getting a scrape and knowing exactly which plant to go to and how to use it. Yeah, that is totally divine. And also, quite recently, I was giving a workshop for a local organization, and we were talking about creeping Charlie. Some people call it Jill over the ground or Glecoma hederaceae. And that was a herb that came to America aboard ships. It was used to detoxify heavy metals from the body. It's also used for tinnitus and upper respiratory infections, and can indeed be used effectively in the mouth. And it seems to invade every gardening space. And when gardeners hear that it has such a profound medicinal use, their faces just light up, and, they're excited to know that something that's so abundant in their own soils has such a profound use.
That's true. Now, let's talk about your book, because a book that you wrote is called Dental Herbalism, Natural Therapies for the Mouth. So of all the interesting things that you really are an expert at in terms of herbal medicine, what made you choose this topic to put so much time and energy into to write this book, which is a must-have book because it's so well illustrated and it's so easy to read, but it has an amazing amount of documented natural therapies that can be helpful for the mouth. And the name of the book is Dental Herbalism, Natural Therapies for the Mouth.
Well, thanks for talking about our book, Ellen. And many things came together for me to write Dental Herbalism. The first of which was I stumbled across some work by a dentist in Ohio, Willoughby D. Miller. And Dr. Miller said that many of the root causes of illness or symptom experiences that present in the body can find their beginnings, their roots in the health of the mouth. And for me, that was really a light bulb going off. I knew as a scientist that digestion began in the mouth, and I grew up in an era where I was taught to brush my teeth mostly to affect the aroma of my mouth so I didn't have halitosis or bad breath. And when I visited the dentist's office, I would get a lollipop when I left. Maybe that was an invitation to come back soon. And so all of those things were rolling around in my head. And as you mentioned in my introduction, I do work as a clinician. I am a clinical herbalist with a practice both here in Erie and beyond. And I had a client whose chronic condition was not moving consistently in the direction either she or I would like it to move. Symptom abatement was very slow. We would see some improvements in her health and then none, and then further improvements. When I came across Dr. Miller's work, as I said, this light went off. I thought to myself, well, why not? I'd consulted with other herbalists and nothing else was affecting a change. So as strange as it seemed, we began to work in her mouth for a condition of inflammation, rheumatoid arthritis, that she was experiencing elsewhere in her body. And slowly, she began to see consistent improvements. That caught my attention. I explored further. I realized there weren't a lot of resources for us as herbalists. Many people work with the tongue, but those who are trained in tongue diagnoses often don't look beyond the tongue at the lips or the interior of the mouth as a whole, as well as the teeth, of course. And that helps to tell a story about health and wellness.
Which is amazing. Of course, many of our listeners may not be familiar with tongue diagnosis, which is part of many of the traditional medical systems and is amazingly helpful and accurate. Also with no x-rays and no kind of invasive. So that might be sort of an entry point, but you're talking about beyond that, the health of the gums and the teeth, and the fact that that needs to be looked at. It should be part of general practice with any situation, both preventatively or as an intervention for more advanced illness.
I completely agree. And I grew up in an era where I didn't know much about my mouth at all. I would see a dentist or a dental hygienist. They would do some cleaning in my mouth. They might even say, oh, I have a cavity that needs to be filled, for example. And my old practice was simply to say, okay. And I sort of abdicated the health of my mouth to dental professionals. And one of the things that I became aware of in writing Dental Herbalism is that it wasn't just me. Many people don't know their mouths as well as they know other parts of their bodies.
Yes, that's so true. Just bypass it. I mean, certainly that's like you go to the dentist to look in your mouth and then the doctor does not even consider that. And here you found a case, and I will say there are many, of someone you were working with who had something like arthritic pain in other areas of their body due to systemic inflammation. And when you worked on things going on in their mouth, which I imagine they may have had infection, either overt or hidden, that it started to reflect in overall inflammation of the body as well.
That's absolutely true. And, you know, when I stopped to think about it, it made perfect sense. And I like to use the image, the scenario of if I'm outside and I'm running along and I'm jogging and I trip and I fall, I graze my calf, well, I'm going to clean that graze, not just to avoid a local infection, but also to avoid a systemic infection, those microorganisms that I bumped up against when I fell, they're entering my blood and moving around my body. And many people who brush their teeth or floss their teeth or seek a professional intervention find that they too might bleed in the mouth. And that opens up a pathway for microorganisms that normally reside in a healthy mouth. And of course, those microorganisms that may reside in an unhealthy mouth, for each of those to enter the bloodstream. And then they in turn can affect health throughout the body. And this relationship is called an oral systemic connection.
And you have beautiful illustrations in your book about how that would happen, both with actual photographs and also more like cartoon illustrations to help explain these concepts of how, and this is just science, how connected the mouth is to the general circulation. And, just recently, I would say in the last few weeks, there were some big shout outs from the medical community about the realization of the link to mouth health and heart health.
Heart health, low birth weight. There have been a number of associations. And of course, perhaps the most well-known is the health of the mouth and its association with joint and organ replacement and the successes of each of those interventions, as well as long-term outcomes.
So it seems that it would be something that should integratively be referred to with every healthcare provider. It should be part, they say go to the dentist, but I mean they don't seem to understand the implications of how tightly woven these things are together.
I would say that's true. And speaking just about myself and the people that I've worked with over the last decade and a half since coming back to America, I would say it's been my experience and those of my clients that a primary care physician never asks about the health of the mouth, and a dentist or a dental hygienist or a specialist in oral medicine rarely asks about food. And it seems as if we could have some good conversations and some wonderful opportunities for education. Just by opening
you
up.
are really right, Dr. Alexander, because you're even on the intake form, on any kind of medical doctor that you walk into, I don't think I've ever seen that question. Even in that list of different kinds of health that might have happened, associations with heart disease and cancer or whatever in your family, I've never seen anything included in the questionnaire about, what's going on with your dental health.
I think that's true, and I think there is perhaps scope in the broadest sense when we're asked about hospitalizations or operations to reflect and to say, well, yes, I was treated as an outpatient for, a root canal. But I don't think people include a reflection on oral health when answering questions like that, nor do I think the questions are intended to gather that information.
Well, the illustrations in your book are so excellent to help anyone understand the importance. For instance, on page 33 in your book, Dental Herbalism, you have a wonderful x-ray that really clearly shows how, let's say, the root of each tooth is actually connected to something that goes right into the general circulation. So it's not really esoteric. This is just scientific.
Yeah, I'm glad to hear you say that, Ellen, because we went to great pains, really, to put together a resource that would be useful not only to my fellow herbalists, our fellow herbalists, but also to the dental profession to introduce them to ways that people can effectively and affordably care for the health of their mouths. And we also wrote for the general public so that we even begin with approaching a dental office knowing that many people have fears associated with going to see a dentist or going to see a dental hygienist. So we begin with not just the mouth, but even before that, who are the people that you'll meet when you make an appointment to have your mouth looked at? And what do they do? What can you expect?
Right, and that I think many people know just in terms of their regular dental visits. But what we're going to do here, Dr. Alexander, is we are going to take a break. And when we come back, we'll allow you to share some very specific information that's in your book in terms of dental herbalism. What herbs and what techniques? What is a chewing stick? All the very interesting things that you have in great detail in an easy to follow manner in your book. Not only is it easy to follow for consumers, it's well documented for physicians and other healthcare providers. So we will be right back, and we're talking to Leslie Alexander, PhD, RH, Registered Herbalist, and community-based herbalist in Erie, Pennsylvania, and she also does consults virtually from anywhere. She is a scientist, and she is the author of Dental Herbalism, Natural Therapies for the Mouth. We'll be right back with more right here on Progressive Radio Network, The Natural Nurse, and Dr. Z.
On this edition of the Natural Medicine Chest, we'll explore the medicinal properties of the plants of the ephedra genera, focusing on the traditional Chinese ephedra, also known as mahuang.
Many species of the plant ephedra are used today in medicine throughout the world. The most medicinal of these are Ephedra sinica, or Chinese mahuang, and Ephedra nevadensis, also known as Mormon tea. Most of the research on ephedra has been performed on mahuang, whose stems and branches have been used as a traditional Chinese medicine for over 5,000 years in the treatment of asthma, hay fever, bronchitis, as well as the common cold.
Ephedra species are erect evergreen shrubs which grow in segmented bamboo-like joints reminiscent of straw ending in thin wisps. They typically are desert plants preferring arid conditions on dry, rocky, and sandy slopes. The Chinese ephedra, mahuang, has earned an impressive reputation as a source of the alkaloid chemical called ephedrine. In the West, scientists became interested in the medicinal usage of mahuang after they isolated ephedrine and pseudoephedrine in 1923. Today, synthetic derivatives have become widely used in prescription and over-the-counter medications. In 1993, over 40 million prescriptions in the U.S. contained these alkaloids.
Ephedra and its relatives are considered to act pharmacologically as sympathomimetic compounds. This means that they stimulate the sympathetic part of our central nervous system, responsible for the release of adrenaline, which leads to the fight or flight response. Ephedra also affects the cardiovascular system by increasing the blood pressure and causes a relaxation and dilation of the bronchial smooth muscles in asthmatics. Ephedra can shrink the swelling of the delicate mucous membranes which line the respiratory system, thus drying up watery discharges, unstuffing clogged nasal and sinus passages which accompany colds, sinus conditions, and allergies.
In both animal and human studies, mahuang has been shown to accelerate weight loss. It has been shown not only to suppress appetite, but to increase the metabolic activity of the adipose or fat tissue. Therefore, ephedra's weight-reducing effects are most significant in individuals who have a low metabolic rate or a sluggish thyroid gland.
Mahuang is a powerful herb which, when abused, can cause some unwanted side effects. Ephedra should not be taken by those with high blood pressure, nervousness or anxiety, insomnia, cardiac conditions, or pregnancy. Studies indicate that when used in conjunction with other Chinese herbs in a traditional formula, mahuang does not have any of these effects and has remarkable beneficial effects on human health.
We recommend consulting a healthcare practitioner knowledgeable in the use of botanical medicine before using mahuang, so you can be further educated about its totality of effects. And before using herbal preparations with mahuang, check to see if you are sensitive to its effects by starting with the minimal dose and working up to a therapeutic dose. Logically, since ephedra is a stimulant itself, it should be used prudently with other stimulants, beverages, or drugs with stimulant effects. Again, consult with your natural healthcare practitioner.
So, listeners, remember mahuang, the traditional Chinese ephedra, and make sure to include it in your natural medicine chest.
And welcome back to more right here on The Natural Nurse and Dr. Z. We'd love to communicate with you directly. So go to naturalnurse.com and just click Contact the Natural Nurse. Click on Calendar to find out all the events, both online and on ground, all over the country. In fact, if we're looking forward into the future, I will be the keynote speaker at an up-and-coming herbal conference, which is called the Mid-South Women's Herbal Conference. And there's so much wonderful information that you can find out about herbals and herbalism by going to the American Herbalist Guild website. And I would like Dr. Leslie Alexander to share with us a little bit about the fact of what is an RH, because she and I are both registered herbalists. So what made you pursue that registration, Dr. Alexander?
Quite a few reasons. Thanks for the question, Ellen. So firstly, I think I wanted my work to be peer-reviewed. Anybody really can call themselves a cook or a gardener or a herbalist. And while I was working with individuals helping to support and balance health and wellness, I really wanted others to have a gander at my work and to comment on the efficacy of my protocols, my professionalism, my understanding of health and wellness. So becoming a registered herbalist is, as we both know, a really rigorous process and requires several hundred hours of study as well as several additional hours in clinical practice before one can apply to the American Herbalist Guild for this title, this distinction.
And I totally agree. So if you are someone who wants to confer with an herbalist about your health, seeing if that herbalist is an RH is a good way to. It can't assure that you'll get along with that person, just like with any doctor, but it can assure that in order for that person to have the RH as a program that they went through, a process that they went through, you can be assured that they have studied for thousands of hours and have been recognized by a peer review process of other herbalists that are very, very well vetted, that they have the right kind of knowledge to be able to interact with a client. And that's a little worrisome because, as Dr. Leslie Alexander just said, anyone, whoever's listening, you can put out a shingle tomorrow in terms of legal things. It's not moral, but, nobody's going to come after you. Depending on your state, they might come after you and say you're practicing medicine without a license. Years ago, you might have been, burned as a witch because there's all kinds of influences like that out there. But in terms of you knowing that someone is knowledgeable and well-trained, you can be assured that if they are an RH, they are well-trained and peer-reviewed. Now, you yourself can join the American Herbalist Guild as a general member, or if you're studying as a student, very inexpensively and instantly, and get access to so much information, such as the registered herbalist in your area, all kinds of journals which are beautifully written and very deeply researched, all kinds of webinars that are totally free once you join as a member. So it's a really great place to go. I actually am the vice president of our local chapter, the Long Island chapter of the American Herbalist Guild, and I participate in Florida as well. So just a shout out to all of you listeners who are interested in herbal medicine. So,
Absolutely.
Dr. Leslie, go ahead.
Oh, I'm sorry. I didn't mean to cut you off. I just wanted to let our listeners know that when they go to the American Herbalist Guild website, AmericanHerbalistGuild.com, not only will they find all of these wonderful educational resources and an opportunity to join the Guild, but even as non-members, they'll be able to find herbalists, registered herbalists in their area with a directory with state-by-state listings.
Well, thank you for sharing that. So let's delve more deeply now into the information one could find in your book, Dental Herbalism, Natural Therapies for the Mouth. What is let's say some of the herbs or some of the procedures that would be great for people to learn about?
Well, that's a great place to start. Many of the herbs, the most common herbs, I would say people are indirectly familiar with if they use mainstream toothpaste. So we think about mint-flavored toothpaste or cinnamon-flavored or fennel or propolis. All of these herbs have a strong history in the use of supporting and sustaining the health of the mouth. So we might, for example, choose to suck on the seeds of some fennel to freshen the breath. However, we can also make a very inexpensive tea of fennel seeds or an infusion of fennel seeds and use this as a gargle. And we can do the same with fresh and dried mint or dried cinnamon, for example. Many of the aromatic herbs, myrrh and boswellia, otherwise known as frankincense, have long-standing use in the mouth, and these can be used in a number of forms, including powders and pastes, and not to mention oil when it comes to oil pulling, which is a century-old, a millennial technique for cleaning the mouth.
Well, since you brought that up, and that's something that's, very inexpensive, very easy, you don't need any high-tech equipment, and it might be brand new information to some people, why don't we talk about oil pulling?
Fabulous. So oil pulling is an Ayurvedic or Indian approach to caring for the mouth. It is a technique or a practice would be a better word. Oil pulling is a practice that is followed each morning upon rising, and many people use sesame oil. We can also use olive oil or coconut oil. We begin with a teaspoon of oil in the mouth, and we literally, without swallowing, pull this oil between the spaces of our teeth, working around the mouth in a logical manner. So, for example, beginning in the upper left quadrant of the mouth and pulling the oil from the outside by our cheek and our gums, pulling it through those spaces into the central cavity of the mouth, and then pushing that oil out through those spaces, out towards the cheek, so we thread it in and out of the teeth, and that helps clean not the surfaces we chew on, but the surfaces in between our teeth. Very, very effectively. Many people report a clean, fresh, ready to go feeling in the mouth. Obviously, it also removes debris from the mouth. So when we're done oil pulling, and we do this for a few minutes, although opinion varies in the literature.
Well, I want to ask you about that, Dr. Leslie, because when I learned about it, I was with an Ayurvedic physician, and he was teaching a class on it. I said, this is great, let me try it. And they said you had to do it for, a long time, like a full 5 minutes, which is kind of a long time for me anyway, in a rush in the morning. And some people say 20 minutes. And it just becomes, challenging to have that much time when you're in this hectic lifestyle. So what do you think is necessary time-wise?
Well, Vasant Lad, who is a leading Ayurvedic practitioner here in the States, he recommends 2 minutes. Many people engage in oil pulling while they're doing other morning activities. So some people will pull oil in the shower, some people will pull oil while they're sorting their clothes for the day, or putting up a kettle for a cup of tea. So I think 2 minutes 2 to 5 minutes is certainly more than adequate. And then it's important to remember to spit out this oil and not to swallow it. Many people keep a receptacle in the bathroom and out of public view, and simply open up the lid of this receptacle, spit their oil into it, avoiding clogging up pipes and drains and things. And that's it. Once a day, every day.
Well, now that you brought up Vasant Lad, I'll share a story about him. He is really, really knowledgeable and has written many books, so he's easy to find. And as part of the panel of traditional medicine at Columbia Presbyterian Medical School, and we decided to use that word traditional in the traditional sense, meaning ancient medicines, we actually invited Dr. Vasant Lad to do some experiments within the hospital, Columbia Presbyterian, where he was actually asked to use his non-invasive pre-symptomatic diagnostic techniques, which is so well known in traditional medicine, such as what you're talking about, tongue diagnosis, pulse diagnosis, things like that are thousands of years old. And they matched him against the use of the most updated machinery with x-rays and blood work and all the things that go on in conventional medicine. And he was, it was close to 100% right on in terms of his ability to diagnose what was wrong with an individual patient, and it matched so closely to all those invasive tests. Now, that is, again, amazing, because I think there should be a reevaluation of the use of traditional both diagnostic techniques, holistic assessment, and natural therapeutics as the first line of intervention in all of standard of practice medicine, because it is much less invasive, much more cost effective, and really with better overall patient outcomes in the end.
I agree. I think that sometimes there are people who rely on tests and what the test reports, and they don't always take the time to get to know the individual. And I remember being in Greece years and years ago for an extended period, and the person I was with had an oral care issue, and for several weeks a local dentist treated her by smell alone, by observation and by smell. And there is so much to be gleaned from getting to know the people we work with and their health concerns.
And unfortunately, and I'm not going to blame doctors for this, because they're just as frustrated as we nurses are and as everyone else is, that now a lot of doctors never touch, never smell, never go near the patient. They're on the other end of the room, and they're sometimes, now worse than ever, their back is facing the patient. They are facing the computer terminal, and they are searching for the appropriate codes to put in for whatever prescription they're going to write for that patient, which is all they're going to do, because they only have 8 minutes.
Exactly. And you and I both know that when we sit down to work with an individual, whether we're working face-to-face, eyeball to eyeball, or we're working at a distance, we spend far more time than 8 minutes, whether we're addressing their health in its entirety or we're focusing, as we might in a walk-in clinic, on particular acute or chronic aspects. of
That is
health.
so true. Well, we're going to take another break right here, and we are speaking here on The Natural Nurse and Dr. Z on Progressive Radio Network with our guest, Dr. Leslie Alexander, PhD, RH, and author of Dental Herbalism, Natural Therapies for the Mouth, although her knowledge extends much more widely than just dental herbalism. And we want to give our wonderful station, Progressive Radio Network, a chance to say hello and tell you about so many of the other wonderful shows that are right here on prn.fm. We'll be right back with more.
Hi everyone, I'm Gary Null, the founder of the Progressive Radio Network. Today we have more than 80 producers bringing forth the most progressive and most liberating information, the kind of information you do not regularly hear on any of the mainstream or alternative media. You can help us now. Up to this point, I have virtually supported the Progressive Radio Network, all of its expenses and payroll, myself. But we would like to expand our reach. We'd like to do far more. We'd like to be able to advertise on Facebook and let others know we exist. We are the #1 progressive radio network in the world. In fact, we have programs that are most listened to in all of progressive radio. But we could go a lot further. Our message can reach a lot more people, especially at a time when people are desperate for honest, objective insights on the important topical issues of our day. How can you help? It's simple. Go to prn.fm, go to our main page. In the upper right-hand corner, you'll see a little button, Support Now. And then whatever you can contribute on a monthly basis will make a big difference. It will help get the message out. It will help inform more people, will give them more choices. This is where you'll hear in the independent candidates and the people looking to challenge the corruption in government and industries. But we need to get our reach out further. So please, whatever you can afford on a monthly basis, and there's some suggestions there, and it'll be automatic. All right? Thank you very much for continuing to help us help you and the rest of the world on these important issues.
It's the Ralph Nader Radio Hour.
Stand up, you've been sitting way too long.
Every Thursday at 2 p.m. on the Progressive Radio Network.
This is Karen Hartglass, host of It's All About Food, and you're listening to PRN, your source for progressive, up-to-date, and inspirational information on nutrition and health.
Again, right here on prn.fm, and you are listening to The Natural Nurse and Dr. Z, and I love getting information from you. So many people go to our Facebook page at naturalnurse.com and, do whatever you do there, like or friend. I don't know. I'm not really so up on all those things. But I do know that we get feedback from people all over the country and the world that they are listening to The Natural Nurse and Dr. Z, and we're so excited to know that we have about 300,000 people downloading our podcast. So that is very fulfilling because that's what we want to do, is get you this information. And our guest today is Dr. Leslie Alexander, PhD, RH, and we're talking about her book, Dental Herbalism, Natural Therapies for the Mouth. We have time for a few more questions, Dr. Alexander. For instance, here's an interesting one. I'm getting up there in years, and I know a lot of people who no longer have any teeth. So do
Mhm.
they need to be concerned about mouth care?
Oh, absolutely. What a great question. So we begin our lives, and many of us end our lives without teeth, although it is important to appreciate that our teeth are indeed meant to last us a lifetime. So whether we have a full complement of teeth as young people or adults, or over time we lose teeth, it is very important to continue the care of the mouth. And even for those who have had all of their teeth extracted, ensuring that the gums are well oxygenated, that there are no signs of inflammation or abrasion. And abrasion can result not just from getting pricked by, I don't know, a bone in some chicken soup, for example. It can also result from ill-fitting dentures. Or for people with teeth, often abrasion results due to the fitting of braces to realign the teeth. So absolutely, care for the mouth without teeth is critical.
So you could still do that oil pulling that we described earlier.
You could
What are
do
some of the
oil.
other best herbs to have around the house, and how would using them be different than just using like a mainstream toothpaste?
Well, one thing, giving up a mainstream toothpaste is you're also giving up the use of fluoride in the mouth, and fluoride is a class 1 neurotoxin, so perhaps should and can be avoided quite easily. We can use thyme and sage and calendula and cinnamon. Let's just stick with those few herbs, maybe a few mints. We can grind herbs into a powder and blend them together to make a powder. Perhaps the best known on the retail market is the age-old Dr. Christopher's tooth powder, which can be purchased online, even though Dr. Christopher is no longer here with us. So we can use powders. We can also easily make pastes by choosing bases for our preparations that give us that smooth feel like we're accustomed to with tooth powders. We can use dried herbs like sage, for example, directly on the teeth to whiten the surface of the enamel. And that's done often using a burnt sage leaf and abrading the surface with the finger in a gentle circular motion. And then
So are you talking about the ashes? So you would burn a fresh sage leaf or a dried sage leaf?
You'd burn a dried sage leaf, you would collect the ashes, and then you can use that charcoal to whiten the teeth.
I'm going to try that. That's one of the reasons I love doing radio shows. I've been doing natural medicine since 1964. That's with a 6. But every single day, there is new information to learn. And I never heard that one, Dr. Alexander. I'm going to try it myself.
I think it's a lot of fun. And then, of course, earlier you mentioned the use of miswax or roots that can be easily transported and used to clean the teeth as well as improve circulation in the gums, and can be stuck in anyone's back pocket or knapsack or purse, and really enables us to meet the ADA or American Dental Association suggestion of brushing 2 to 3 times a day for 2 to 3 minutes.
So that's interesting because the use of those toothbrush sticks, when I take people to live with sort of shamanic healers in various areas of the world, and we do that through a group called Echo Tours for Cures, we find that regardless of where we go, that is a common practice to have something that is called toothbrush tree. It might be in different languages, but we find that to be consistent in all kinds of civilizations.
Absolutely. And these toothbrush trees have particular characteristics in common. So whether it is the twig of a tree or the root, as in the case of licorice, as compared to birch, licorice we use the root, birch we use a twig. These medicinal herbs are antimicrobial. Some enhance saliva in the mouth, and having a moistened mouth ensures that the pH is about neutral, and thereby reducing the likelihood of caries. So throughout the world, these are well relied upon tools. And of course, from an environmental perspective, they are not contributing to the refuse that we find in landfills.
Wow, that's a really good point as well, because they're all natural. Boy, for the East Coast of America, find your birch tree. Obviously make sure you go with an herbalist or even a horticulturist and do the correct identification. But once you break that twig and you smell it, it smells like toothpaste. It's just amazing. I use them all the time. So we're actually coming to the end. Dr. Leslie Alexander, can you please tell people the best way to find you for more information?
Absolutely. Thank you very much. So I am online. You can find me at restorationherbs.com, or anyone is free, of course, to email me, Leslie at restorationherbs.com. And as you have such a strong focus on education, Ellen, I would like to mention that in November and December, I have some oral care workshops coming up, focusing on both getting to know the mouth as well as matching oral care regimes with individuals, and then working with children and infants. So that's relating to the mouth. And I also have more generally relating to systemic health, a seasonal empowerment series beginning later in the month of November. And you can find details for each of these workshops by going to restorationherbs.com and clicking on calendar.
Well, thank you so much. And thank you, listeners, for joining us once again for another edition of The Natural Nurse and Dr. Z. That's Eugene Zamperone. You can find us at naturalnurse.com or Facebook, The Natural Nurse. Until next time, this is Natural Nurse Ellen Kamai, hoping that you stay healthy.